I'm Dr. Becky Lynn, and I'm back again to discuss sexual changes during menopause because there are many. The first thing I want to discuss is the changes that happen to the vagina. So before you go through the menopause, your body makes estrogen, progesterone, and testosterone, and your vagina needs those. Once you go through the menopause, your body's not making estrogen and testosterone, and what happens to the vagina is it gets very thin and dry. A premenopausal vagina is thick, it's moist, it lubricates well, and it's stretchy. A postmenopausal vagina is thin, it doesn't stretch, it's dry, it doesn't lubricate. And when that happens, you can have painful intercourse and painful sex. And of course, painful sex can lead to low libido and problems with orgasm and problems with arousal and lubrication. So it's just a big cascade. So what can you do about that? Luckily, there are a lot of wonderful treatments for that vaginal dryness. I usually start by recommending lubricants and moisturizers. So lubricants are designed for use at the time of sex. And basically what they do is they help decrease that friction. And there are several varieties of lubricants. In fact, there's over 100 different types on the market. But I've divided them into water-based, silicone-based, and oil-based. So if you're postmenopausal and you're not using condoms, you should throw away the water-based ones. The water-based ones are sticky, they dry up quickly, and you have to keep reapplying them. You should choose either a silicone-based or an oil-based. So the silicone-based ones are not as sticky, they don't have to be reapplied as often, and there are many of them on the market. Amazon is a great place to find many lubricants and moisturizers. What you do is you put some lubricant in your hand and you put it on the vulva, the outside of the vagina, and then you also put it on your partner, and that just helps things slide so things aren't stretched and dry. You can also use oil, and by that I mean olive oil that you have in your kitchen. You can absolutely use that as a sexual lubricant. It's a little bit more messy, but it's right down the hall or right downstairs, wherever you are. And it's not terribly expensive. Moisturizers are different from lubricants. So vaginal moisturizers are kind of like the moisturizers that you use for your hands. So you wash your hands at the sink, you put a little bit of lotion on your hands because your hands are dry. So the vagina needs the same kind of moisture, especially during the postmenopause. There are many vaginal moisturizers on the market. There's Lubricants, there's Replens. I tend to favor either Crisco or coconut oil. So Crisco, I know that sounds really weird, makes you think of fried chicken, but it works really well, and it doesn't have a lot of chemicals that can irritate the lining of the vagina, because a postmenopausal vagina gets irritated very easily from chemicals. And you can use as much or as little Crisco as you want, as often or as infrequently as you want. Some people will put some on in the morning and night. They put it at the opening of the vagina, which is the most sensitive spot. This is called the introitus. And postmenopausal women tend to feel the most pain there, especially on penetration. So you can put just a little bit of Crisco on your finger or coconut oil, whatever you choose to use, and put it at the opening. Or you can just apply it after you go to the bathroom. So if you go to the bathroom, you can take a little tub of Crisco, have it in your bag, and every time you pee, you pat dry and just put a little bit of Crisco on the outside. But there are no hard and fast rules to Crisco. You can use as much or as little as you like. Now, all of these lubricants and moisturizers do a really good job at affecting friction, maybe feeling a little bit more moist. But the only thing that really restores the stretchiness of the vagina are hormones. And it doesn't have to be swallowed hormones or a patch. Those are not the best for vaginal dryness. The best hormones for vaginal dryness are intravaginal, ones that you place in the vagina because they're right there, they're local, and what they do is they thicken the tissue, they make it stretchier, they add elasticity, and you really need elasticity to have satisfying good sex. The other thing that the vaginal hormones do is they bring blood flow, they bring nerve growth. And so some postmenopausal women will say, I just don't feel anything anymore. The sensation is lost due to the lack of hormones. So if you use intravaginal hormones, it helps restore that sensation because it brings blood flow, helps with lubrication, brings nerve growth. Intravaginal hormones may also help with orgasm. So the most common thing I hear in my practice from postmenopausal women about orgasm is that they have to work so hard to reach orgasm, and when they get there, it's like, wasn't really that great, so is it worth it? But if you use intravaginal hormones, you can really restore your orgasms to maybe not what they were before, but much better than without those intravaginal hormones. And the good news is that the intravaginal hormones don't carry the same risks as swallowing a pill of estrogen or wearing a patch. They don't increase your risk of blood clot, heart attack, stroke, or breast cancer. Sometimes they cause a vaginal discharge because what you put in the vagina eventually comes out, but they really do a lot of good. And one last thing that I just remembered, and I think is important to mention, when you use intravaginal hormones, and by hormones I mean estrogens, like Premarin vaginal cream, Estrace vaginal cream, or there's a new one on the market called Intrarosa, which has estrogen and androgens in it. And androgens, like testosterone, help the glands that make the moisture also. So that one is fantabulous. We know that estrogens do decrease your risk of recurrent bladder infections. So some women in the postmenopause are at higher risk for getting bladder infections, and they're constantly on antibiotics, constantly coming down with a bladder infection or a UTI. So if you use a local estrogen in the vagina, it will decrease that risk of getting bladder infection after bladder infection after bladder infection. So please subscribe, please share. I plan to, every week or so approximately, discuss something interesting related to sexuality, and I have so much more to tell you all. So thank you for tuning in. Good night.